And now on the line is Róisín Clarke. Róisín is the acting CEO of Mental Health Reform. Róisín, welcome to the programme.
Thank you very much, Darren. It's great to be here.
Okay, Róisín, I've done a lot of interviews with different members of your organisation over the last nearly 10 years, and I interviewed your regular CEO, Fiona Coyle, a couple of times this year as well. Budget 2023 will be announced over the next couple of weeks, and I know that yourselves, like many other organisations, launched your pre-budget submission recently. Bearing in mind the influence of COVID-19 and the cost of living crisis we have at the moment, can you tell me, Róisín, how important and serious this upcoming budget is to yourselves in mental health reform and the people and organisations you work with?
Absolutely, Darren, and thanks again. And you're right, the budget will be announced on early this year. It's on the 27th of September. And as you know, Mental Health Reform Well, we're the national coalition for mental health. We represent 81 organisations working in mental health services and support across the voluntary and community sector. And we're calling on the government to prioritise mental health in budget 2023. And as you know, Darren, we have been warning that the pressures on Ireland's mental health system have reached unsustainable levels, and government action has to be taken immediately because we are going into a deepening mental health crisis. And we have to express concern, Darren, because while the urgency of the pandemic may appear to have faded, the mental health shadow pandemic, as some people are referring to it as, will be felt long into the future if we don't act now. You know, the old turn of phrase would be breaking a bigger cross, I suppose. But ultimately, people with mental health difficulties can't afford to wait any longer. So we're asking the government for an additional investment of at least 100 million in budget 2023, and that's to deliver on urgent reforms in the mental health system. And just to say for your listeners, that 100 million is broken down into two categories, and that's 25 million for the maintenance of existing services and 75 million for the development of services to address an existing unmet need. But when you asked me there about the pandemic and where we are at the minute, I'd love if I could just to give you a bit of an indication of where we are at present. And so far in 2022, the waiting lists for the child and adolescent mental health services that we all know as CAMHS, there has been an increase of almost 60% in that period. Now we're talking about child and adolescent mental health, and I think yourself, Darren, and anybody will know that delays to accessing care are extremely harmful for children and young people, especially when they require them for urgent care. Early intervention is absolutely key, and you're talking about the longer term impact on a child's life into adulthood and their quality of life, their well-being, and how they get to engage with life as they grow older. There was also another study out earlier this year. It was by the ERSI, and it was published in June, and that reported that 55% of women and 40% of men aged between 22 are classified as depressed in Ireland. And then finally, if you don't mind, I just would like to mention, and I think it's a really important statistic, if people would just sort of bear with me, there was a further Irish study across a collaborative of universities this year, and it highlighted that there was over 40% of the population in Ireland experience mental health difficulties. And I think that's a bit of a shocking statistic. And I think, do you know, Darren, the figures speak for themselves. But when we talk about stats and we talk about figures, I think it's really, really important that we remember there are people behind those stats and there are people behind those figures. And just with regard to CAMHS, there are children and young people who are on those waiting lists, and you're talking about their family members, their parents, their siblings, you know. So I think we really need to put pressure on government to act now, because people can't wait.
I've discussed this with several of your other members over the years, but like the biggest problem as regards funding, along with funding for mental health services, there's a huge shortage of key staff, isn't there? Like you have, like there are not enough professionals in some areas, like for example psychologists and other professions, and and because of, am I right in saying this, because of the cost of living crisis, you have a lot of professionals even leaving Ireland, going to work in places like Australia and all this. That's happening, isn't it?
There is a staffing crisis at the moment. Absolutely is. But this year, the government published the 2022 to 2024 implementation plan for sharing the vision, and that's our national mental health policy. And in that plan, it accounts for the delivery of different national clinical outcomes. You know, this is a government document, and if the government is serious about the success of that policy, recruitment and retention issues have to be addressed, and addressed urgently. There are currently about, at least I should say, 235 staff posts at various stages of recruitment that are unfilled in mental health services. And it's absolutely critical that the HSE prioritise workforce planning and recruit more students, for example, into mental health training programmes. And the funding that's been provided for recruitment this year, it has to be ring-fenced and not really allocated elsewhere. So on top of prioritising workforce planning, we also need to look at initiatives to ensure retention of staff is in place. I mean, that's really important. I mean, these staff have difficult jobs. People working in the mental health sector have difficult roles to play, and they need the support. And then smaller, more practical but impactful measures, such as providing maternity cover for HSE staff who work in the national clinical programme, so that the services basically aren't left understaffed when a staff member is on leave, for example. So there's some of the things that, yes, recruitment is an issue, but there are some of the things that we can look at to help address that, Darren.
And I saw a JPEG from you on Twitter there last week saying that in Ireland, the government only spends a third of the money on mental health in comparison with the UK. That's right, is it?
Well, the funding for mental health in Ireland, Darren, is stalled between 5 and 6% of our total health budget for a number of years. Now, that's actually less than half of the recommended spend internationally. The UK and France spend between 14 to 15% of their health budget on mental health. So in our pre-budget submission this year, we're calling on the government to increase the spending on mental health in Ireland to 10% of the total health budget by 2024. And we'd also like to see that aligned with the reinstatement of the national lead for mental health, because we have to ensure proper oversight and leadership, you know, as we seek to improve the services. But I mean, back in 2016, the Vision for Change recommended 8% spend. Sláinte Care itself recommended 10% in 2017. So I think we're far behind the crowd. We need to honour those recommendations that have been made in the past, and we need to increase the spending of our total health budget on mental health to 10%.
And along with that, you mentioned a minute ago, like, have the government announced that they are going to have a lead in the Department of Health on mental health, a clinical lead, I think the term is, or something, for overall mental health services?
Yeah, they have not announced that. They have not announced that yet.
And is there
that
reason?
is one of the key asks.
Is there a reason? Do you know why they haven't announced that?
As to the reason why, I'm not privy to that at the moment, Darren, and I know that it was through some restructuring a number of years ago that the post was changed, but we'll be certainly calling on that. I think it's crucial because we need to have that kind of oversight, and we need to have that kind of leadership to make sure that funding is used and disseminated throughout the mental health system correctly.
Okay, to look at the big picture, Róisín, in terms of mental health services over the next few years, are you in any way confident that there will be an increase in funding for mental health services over the next few years in line with what is said in the strategy sharing the vision?
But Darren, I suppose I would be positive that government will honour the recommendations that it has made itself, and we are very actively engaging with public representatives across government, and we will be meeting with Minister Mary Butler as well in the coming weeks. But one of the things, if you don't mind, I would like to say it is crucial that we have as much public support as possible. Mental health is a vital issue, and people have every right to pick up the phone, to send an email to their local representatives to get behind this, because there is strength in numbers, Darren, and public representatives will listen to their constituents. So it's really important that we make our pre-budget submission, and we fight and we shout and we represent, and it would be just amazing if we could also have the public to get behind us on this push, because it is your right to say what issues are close to your heart and what you want your local representatives to raise at government, and that's basically how we affect change in the end. So it's strength in numbers, Darren, I think, and it would be really important at this time, because we are facing into what could be very difficult times in terms of the mental health sector, and we need all the support. And I'm sure a lot of people that are listening to you, Darren, on a regular basis are very familiar with the work that the voluntary and charity sector carries out in terms of providing mental health supports and services and access. We really need to make sure that proper funding is allocated within the voluntary and charity sector. It's often the front line or the first line for people who require services and supports. So it's really important that I think that we all pull together and get behind this now.
Okay, and Niamh, tá go leor aglah raidió déanta gom le honnaithe eile ó mental health reform na beagnach de mbliana anuas, agus tá cúpla ceann déanta gom in mbliana le Fiona Coyle príomhfhoirmneacht na hagaíochta freisin. Bei Buiséad fit a trí a ógurt ag an airgardis níos déine an bhí seo, agus tá is a gom gur cheol sibh áineacht réamh Buiséad chuige le déanaí. An féidir a rálam a Niamh beagánní faoi céicó tábhachta agus tromcúiseach is atá an Buiséad imléana dom mental health reform agus na daoine agus eagraíochtaí eile lena n-oibríonn sibh?
Tá an Buiséad Harveh táchtach de mental health reform agus de nagraíochtaí na Brianlin. Mental health reform is an córialtas náisiúnta bhearlánta in éireann. Tá 8 héan buileagan, eagraíochtaí atá gobar san airneáil carnachta, agus an aim atá goin ná go mbeadh gachtainna ábalta takeíocht áil ina bubal féin chun an mear sláinte is fearr a bheith acu. Tá sé tuairt faoin aire le blianta beaga anuas go bhfuil an córas mear sláinte faoi bhrú de bharr aspa muoinethe. Agus rith COVID bhí na listí feitheamh anna ada, agus bhí aspa seirbhísí i gceantar áirithe. An sin nuair tharla an pandéim sa bhliain fiche, d'fhirg sé a bhfad níos measa. Bhí anna cuid dacreachtaí ag daoine ar nós uaignas in ní dúlagar, agus dá bhrí sin bhí éileamh níos mó ar sheirbhísí ar fud na tíre. In nómh tá an pandéim nach mór imethe, ach tá na hirbhirtí fós le feiceáil sa chóras mearchlanta. Tá na listí feibh I bhfad níos fuide ná mar bhí roimh COVID, mar shampla I mí bealtainna bhí níos mó ná 4,000 agus 300 páistí agus dégóirí ag feibh I gcóir seirbhísí child and adolescent mental health services as béarla. Agus sin méadú 60 faoin gcéad ó 2019, caithfidh mé rá go bhfuil na muoine sin an a tramcúiseach de leanaí go háirithe nóir tá córam pránach ag tastáil túthe. Tá sé sa léir go bhfuil an éileamh ag méadú ach níl an muoinú a chafar ar sheirbhísí mearchlanta sásúil ar churbe. I mbliana, níl sa Buiséad náisiúnta mearchlanta ach 5.5 faoin gcéad den Buiséad iomlán sláinte. Tá sé sin anna íseo go mprád le tíre eile. Mar shampla, sa bhratan caitheann siad nach mór 15 faoin gcéad, agus sa roinnt caitheann siad níos mó ná 40 faoin gcéad. Moltar 10 faoin gcéad sa folasí sláinte céir. Tá sé riachtanach agus tharbh a táchtach go gcaitheann an rialtas 10 faoin gcéad den Buiséad sláinte ar seirbhísí mearchlanta roimh 24. Agus is é seo an príomh-bhola atá gin sa Buiséad mbliana.
Okay, ein team. Am alleen multi gwif marjaren an Buiséad in mbliana?
Seaarn, so sa Buiséad 53, tá míad ag lurg €100 milliún breise le haig seirbhísí mearchlanta. Cad atá gceist lei sin? Well, tá míad ag lurg €25 milliún le haig an seirbhísí atá ann faoi láthair. Tá muoinú ag tastáil coniad a cumad, agus tá míad ag lurg €75 milliún chun seirbhísí nua a chur fáil. An nólas go tá policy mearchlanta ag an rialtas dar bhanam sharing division, agus mar sin tá míad ag lurg €38 milliún chun policy sin a chur a bhaim chun seirbhísí nua a chur fáil de grúpaí éagsúla ar nós dína gan díden mar shampla dína le dual diagnosis, dína le psychosis, agus grúpaí éagsúla eile. Comáile sin tá míad ag lurg €50 milliún le haig agriochtaí ag tá ag obair san airneáil cathairneachta nó an community and voluntary sector as béarla. Tá isacin go bhfuil obair úntach déanta ag cathairneachtaí mearchlanta in éireann, agus go háirithe le linn na pandéime cumnic mar cé cótáchtach satá siad. Bhí taide déanta gin an iarraig dar bhanam Brave New Connections, agus tá spáinneann sé go raibh nó go 5 faoin gcéad dos na carnachtaí mearchlanta in ann seirbhísí digitach a chur ar fáil le linn na pandéime, agus tharla sé an na hap ar fad ach dairgló an takeíocht sin a thabhairt do dhaoine. Inis tá míad ag teacht amach ón pandéim ach tá muoinú fad tearmach ag tastáilt ón carnachtaí mearchlanta chun na gnáthseirbhísí a chur fáil do dhaoine agus chun na seirbhísí digitach a arbeirt comá. San aonach atá gin tá míad ag curbéime chomá ar grúpaí suntasacha nó priority groups, so tá €10 milliún álar go gin chun beabhas a chur seirbhísí le haig grúpaí cosú leis an pobal LGBTI+, mionlaigh etnacha agus príosúnach comá, mar pásagan go mbíonn níos mó fadhbanna mearchlanta ag na grúpaí sin ach tá cuidas na seirbhísí nábhú arúnach nó tá dúshlán ann.
Is cuireann roinnt mí ó hen rinne mé aglah as béarla le sí Saoirse Brady an támatá orthaí capimse ag caint bhí sláinte intaine agus presúna agus ceist olmhór é. Okay, Niamh, chun áchar an picture umláin sa mblianta atá amachrán, an bhfuil mar an dóchas nó muoine na gibh i mental health reform go bheith ardú ar an muoinú a chafar ar sheirbhísí sláinte intaine mar tá molta sa strátaí sharing division?
Se gan dat tá míad dóchasach go bhaid míad an muoinú atá lurga in mbliana. Tá aitheanta saon go bhfuil fadhbanna mearchlanta comórta sa tír seo agus tá fadhbanna mearchlanta ag dul méid tar éis COVID mar shampla tháinig taide amach i mí meitheamh ón ESRI ag díriú ar glíne óga le linn na pandéime agus tá spáinneann sé go raibh dú lágar Cailga Cuaig faoin géad de mná agus dahad faoin géad de fear idir 20 agus 22 bliana d'aois. Is ráta anna ord é sin agus feicimid an éileh ag dul méid tá 30,000 duine ag feitheamh i gcóir seirbhísí siciliachta agus is leanaí iad 11,000 chu sin tá 4,000 leanaí ag feitheamh níos mó ná bliana amháin. Ní figúraí amháin iad seo tá leanaí agus tailig ag folant agus ní féidir le feitheamh a thuile. So tá antas ann go bhfuil níos mó muoinú ag tastáit le haghaidh seirbhísí meabhránta. Tá stratéis náisiúnta acuin dar bheanam Sharing the Vision agus an bliain seo tháinig plán amach an Sharing the Vision implementation plan chun an policy sin a chur bhaim. Agus tá spriccanna ann, tá spriccanna ag buint leis an policy sin i gcóir 2023. So tá na freigraí ann agus tá stratéisi anna bheith ag an rialtas ach caithfear níos mó muoinú agus tá sé sin cótáchtach a gcóir dína fásta agus leanaí ach tá sé táchtach comá i gcóir na bliain eile le tacht.
Okay, chun teachta dro an agalamh Niamh. An bhfuil bailach bic féidir le néistóirí Raidió inniu cabhair a thabhairt libh i mental health reform an bhí seo agus na blianta atá amach roin?
Se tá gan dat mátá tuile ólas uha teirgidí mental health reform .ie tá ar ainacht raibh Buiséad an suíomh idirlín agus tá annachcuid ólas eile ann faoi cuasaí meabhránta agus is féidir le réifos de seola chuig tagta dála áitiúla tá sé sin cótáachta comach gur mágad.